Good evening. My name is Sharon Fitzpatrick, and I will be your moderator for tonight's webinar from El Camino Hospital, Ready, Set, Go, Getting Pregnant, the second in our preconception series. Joining me tonight as our speaker is Barb Dehn, RN, MS, and nurse practitioner. It gives me great pleasure to turn tonight's presentation over to Nurse Barb.
Okay, Sharon, thank you so much. Hi, everyone. I'm Nurse Barb. I'm a women's health nurse practitioner here in the heart of Silicon Valley, and I care for women who deliver their babies here at El Camino Hospital. And I've been asked to share with you what I tell my patients when we talk about what they need to know when planning for a pregnancy, and I'm delighted that you've joined us tonight. Now, before we get started, here's a few details about tonight's webinar. If you haven't already downloaded the personal health assessment, you can do so by clicking on the link in the chat box that you see there. And there's a resource guide with lots of helpful local resources. There will be a link for that sent to you in an email after this webinar. There's also a handout that we're going to send you a link for, and that's for an ovulation prediction chart, and I'm going to walk you through how to do that. You should absolutely take notes, and you can listen to this again through the El Camino Hospital YouTube library. And in 1 week, you can go to nursebarb.com, and I'll have it on my website as well. Now, we're going to have lots of time at the end for questions. But if they come up, please put them in the chat box and we'll get to as many as we can. At the end of our webinar, we're going to ask you to fill out an evaluation guide because we do change our webinars and add new ones based on your feedback. In fact, tonight's presentation was so popular last year that people wanted even more information, so we went from 3 webinars on how to get pregnant to 4. So let's talk a little bit about what happened in our last webinar. So I'm going to give you a little recap. The last webinar, which you can access on the YouTube webinar, was called Thinking About Getting Pregnant. And it's what you and your partner need to know now. And during that webinar, we talked about how you envision your life as a mom, a dad, and as parents, how to improve your couple communication, lots about your medical and family history, medications, vaccinations, travel. We talked about age and risks, and also how to get enough sleep, and a little bit about mental health and stress. So as we get this webinar started, I'd really like to know a little bit about your plans for pregnancy. So Sharon's going to help us with this poll. So how soon would you like to become pregnant? Now, a lot of my patients tell me they want to be pregnant yesterday, so that means as soon as possible. But maybe you're thinking about this within the next 1 to 3 months or 6 months, within a year or more than a year. So Sharon, you're launching our poll. What are you finding?
I would say right now we're split 50-50. And again, if you can just put it in the questions.
So we're split 50-50. What are the two things?
As soon as possible and within 12 months.
Okay, well, you've come to the right place. So let's talk about what we're going to cover tonight then. We're going to talk about nutrition and exercise, which is super important. We're going to talk about how to increase your chances of becoming pregnant and how long you might expect for it to take to become pregnant, when you might want to see a specialist, how to predict ovulation, how do you chart your fertility, what are your male partner concerns if you have a male partner, more on resources, and what El Camino Hospital might be able to offer you. So before we dive into nutrition, let's talk a little bit about how concerned you might be about nutrition. So we're going to launch another poll here. So how concerned are you about nutrition? You can select one of the following. Not at all. You eat a very healthy diet. You're a little concerned. You probably need a few more veggies. You're very concerned because you might not be getting enough calcium or protein. And the last option is you need help with this. So I'd like you to take a moment to answer the poll, and Sharon can tell us what you're finding out.
This is like a roulette wheel. It's changing constantly. One becomes the favorite, then another becomes the favorite. So let's give it another 10 seconds, and then I will close the poll and share it with everyone.
Okay, so even me, and I talk about nutrition all the time. All right, so it looks like we're split. You know, a lot of people need help, and about 38% say they need more help. And some people, about 13% are getting a healthy diet, but everybody else looks like they need some help. So let's talk about things that might surprise you. Even if you're eating a healthy diet, you may be surprised to learn that if you can develop better healthy nutrition now, it really will be great for you and your baby during your pregnancy. So I'm going to use the MyPlate from myplate.gov, and we need, when we're pregnant, about 2 to 3 cups of vegetables every day, 2 cups of fruit, and that's not fruit juice. 3 servings of calcium-rich dairy, that's milk, yogurt, or cheese, 6 to 8 ounces of protein, lots of grains, and in an ideal diet, you would get plenty of your vitamins from your fruits and vegetables. But when you're planning a pregnancy, we're going to encourage you to use a prenatal vitamin that has both folic acid and DHA in it, and I'm going to talk to you a little bit about that in a moment. The DHA is very important for the baby's brain and eye development. The folic acid helps reduce the very, very low risk of having a baby with a spinal cord or neural tube defect. So when it comes to getting pregnant, we'd like you to be on taking a prenatal vitamin at least 3 months before you start trying to get pregnant. All right, let's start with fruits and veggies. You see all the color here? We'd like you to have lots of color on your plate. 1 cup of raw or cooked vegetables, such as broccoli or carrots, equals 1 serving. For leafy greens like salad or kale or spinach, it takes 2 cups of those raw greens to equal 1 serving. Now, when it comes to fruits, only 2 servings a day are recommended. And as I said, try to avoid fruit juice, because when you have juice, it breaks down the pectin and the fiber. It becomes basically fruit sugar. So it's better to eat the whole fruit. When I think about fruits, we think about this time of year in California, at the farmer's market, getting those luscious strawberries or blueberries at breakfast, maybe having an apple as a snack, and maybe some cut up melon after dinner. Let's switch gears and talk a little bit about calcium and dairy, because these are very important nutrients for bone and muscle health. And it's recommended that women have milk, yogurt, or cheese, and not to have supplements unless it's absolutely necessary. We'd like you to get that calcium-rich dairy. 3 servings a day will equal 1,200 milligrams of calcium per day. So 1 cup of milk yields about 300 milligrams of calcium, and 8 ounces of yogurt, about the same. Now, it takes a lot of kale and broccoli to give you the same amount of calcium that's in dairy. But what about those folks who are lactose intolerant? And let me just say, you know, there is some calcium in your prenatal vitamin, but not enough. There's only about 300 milligrams in there. So you really need to get more calcium. Now, if you're lactose sensitive or find that having dairy causes gas or tummy troubles, there are many low and no lactose options that gives you all the calcium and protein plus the 9 other essential nutrients found in milk. So you might consider using lactated milk. And if you don't like the taste, take it from me, add a little bit of chocolate to it, and it'll make it a lot more palatable. You can also look for cheeses that have virtually no lactose, like cheddar, Swiss, and mozzarella. One of the things I ask my patients who are lactose sensitive is, are you able to eat pizza? Because if you can eat pizza, which typically has mozzarella cheese on it, then you may only be lactose sensitive and not lactose intolerant. So I hope this helps you get enough dairy. Now, when it comes to grains, it's recommended that you have 6 to 8 ounces of grains each day. What is a grain anyway? Well, a grain is anything that's made with rice or corn, wheat, or oatmeal. And so 1 serving is 1 slice of bread or 1/2 of a large flour tortilla. 1 serving of grains equals 1 corn tortilla. And now, if you're eating naan or parat or chapati, chapatis, it's 1/2 of a chapati equals 1 serving. And 1 serving equals 1/2 cup of cooked rice, beans, or pasta. And as an Italian, you know, I'm eating a lot of pasta, so sometimes I'm eating like 4 servings at 1 meal, and I'm sure some of you can relate to that. Well, let's move over to protein, because we don't want you to have too many grains. It's better to fill up with protein, which will keep you from feeling hungry, so you won't overeat the carbohydrates or the grains. During your pregnancy, it's recommended that you have about 5.5 to 6.5 ounces of protein every day, because protein is essential not only for your muscles and metabolism, but virtually every system in your body and in your baby's body. So 1 serving of protein might be 1 ounce of lean meat. And think about some of the burgers you might be eating. Some of those are 4 to 6 ounces, so you're getting plenty just with 1 burger a day. 1 egg equals 1 serving of protein. But if you're a vegetarian, you're going to be looking for cooked soybeans or other cooked beans, or even half an ounce of nuts, or 1 tablespoon of a nut butter. Now, what about those vegetarians and vegans? I'd like for you to let me know in the chat box if you're a vegetarian or a vegan. It's super important that you get adequate protein from your plant sources like soy, tempeh, nuts, or combining different vegetables. So here's the deal with combining proteins. Plants have amino acids, and amino acids are the building blocks for protein. But no plant is complete. They don't have all of the essential amino acids. So most of them lack 1 or more essential amino acids to make a complete protein. That's why people combine plant-based foods, like they combine corn and rice or beans and rice. Now, if you're a vegetarian and you have dairy or eggs, those are considered complete proteins, and they have all the essential amino acids you and your baby need. But if you do not have eggs or dairy, then you have to really be careful to be sure to combine lentils with rice, because that yields a complete protein. If you use breads like naan, tortillas, or pastas, they can also be combined with beans to make a complete protein. You want to make sure you're trying tofu, getting lots of nuts and seeds. And if you're a vegan, please, please, please take a multivitamin or a B-complex vitamin supplement and let your provider know so they can check a B12 level.
Before we move on, Barb, we have a couple of good questions here. One is, what about freshly juiced vegetable juice for servings of vegetables?
So that's a great question. It's better for you to have the whole raw vegetable than to juice it, because it breaks down a lot of the fibers that you need to prevent constipation.
And another question is nutrition for females only? Does that apply to the male?
I love this question. This also applies to the men in our audience. It's important for your overall health that you have a balanced diet. And also it's good for you to get into this routine so you can model it for your child. Because children pay attention to what their parents do. Now, remember we were talking about taking your prenatal vitamins. So before you start trying to get pregnant, before you stop your birth control method, be sure to be taking a prenatal vitamin that has DHA, That's a omega-3 fatty acid, and one that also has folic acid. Both of these help ensure and reduce the likelihood of issues with your baby. So I think we have a poll, Sharon. Our next poll, how long have you been trying to get pregnant? So less than 3 months, for 3 to 6 months, 6 months to a year, for more than a year, or you haven't started trying yet. So Sharon, I'm going to let you tell us what's going on with this poll.
Well, we seem to have one answer in particular that seems to get the #1 vote. Let's give it another 10 to 15 seconds. But Barb, what do you think the answer is going to be?
I think 3 to 6 months for most of our folks. What is it?
You're wrong. It's actually 64% say not yet.
Not yet? Oh, good, you guys. I'm so proud of you. You're doing your homework. You're finding out about getting pregnant before you've already started to try. That means if you haven't already, it's good to start your prenatal vitamin now. And remember, you're looking for one that has DHA and folic acid. And if you're a vegetarian or vegan, there are plenty of over-the-counter brands that you can buy that are vegan or vegetarian. There are also ones that qualify as halal. So let's talk about getting pregnant. Let's start right at the beginning, and we'll talk about where babies come from. Now, for most of us, if we're in a couple where there's a man and a woman, then for most of us, you know that intercourse and sex is involved. However, not everyone makes babies by having sex. Some couples use in vitro fertilization. Some use a donated egg. They may use donated sperm. They may use a surrogate. They may adopt a baby. There is no one right or wrong way to start your family. But for the purposes of this webinar, we're going to talk about what happens when a man and a woman are trying to become pregnant together. So all of us, every single person on the planet, started in the same way. One egg and one sperm got together. They started growing and dividing, and eventually that led to a baby. Now, only one sperm will fertilize the egg, but it takes a lot of sperm, as you can see over there on the left, to break down the egg's protective barrier. Let's talk a little bit about a woman's anatomy. This is an illustration of a woman's pelvic organs. At the bottom of the slide, you can see the vagina, and just above it, there's a cervix, and the cervix is the bottom portion of the uterus. Now, the uterus is also known as the womb, and that's where the baby grows and develops. On both sides of the uterus, you can see there are fallopian tubes and ovaries. The ovaries are what make the eggs, and about once a month, a woman will create an egg, it will be released from the ovary, and it will travel down the fallopian tube. And if it happens to meet up with some friendly sperm, it may get fertilized and start a pregnancy. Pregnancies begin in the fallopian tubes. Well, let's talk a little bit about the menstrual cycle. About every month, give or take, a woman will have her menstrual period. Very few women actually have a 28-day cycle every single month. But what you can see on the left is the menstrual phase. That's when the woman will shed the lining of the uterus. And as she's shedding that lining, a new egg is starting to develop in the ovary. And that's at the top. You can see it says maturation of the follicle. So as soon as she starts her period, the whole cycle starts again, and an egg starts to mature. And as it matures, it's sending estrogen signals to the uterus to grow with blood to be prepared for the possibility of a fertilized egg. Most women will ovulate about 2 weeks after their periods start. And it's important to know that eggs will only, after ovulation, once that egg is released, it only lives for 24 hours. Eggs only live for 24 hours. Now, sperm, on the other hand, they live for 5 days. So if there's lots of sperm waiting in the fallopian tubes, when that egg is released, there's a higher chance of getting pregnant. But it also means that a couple can have intercourse on a Monday, and if the woman ovulates on a Wednesday or Thursday, there will still be healthy, viable, or living sperm in the tubes, and she can potentially get pregnant. I mean, we want you to have intercourse around the time of ovulation, but it doesn't have to be exact. Let's talk about fertilization. That's when one sperm enters the eggs. When that happens, you can see on day 1 over there on the left, fertilization, one sperm enters the egg and the father's genetic material mixes with the mother's, and that creates a new pregnancy. The fertilized egg will then divide many times. It goes from 1 cell to 2 to 4 to 8 and so on. And then it becomes, we call this the blastocyst. And as it's dividing, it's traveling down the fallopian tubes so that eventually it can implant into the uterus. And it usually implants about 10 days after fertilization. When the blastocyst implants into the uterus, it starts to produce something called human chorionic gonadotropin, and we abbreviate that as HCG. That's the hormone we test for in urine and blood tests when we test for pregnancy. And that's the same hormone that you'll test for if you do a drugstore pregnancy test. So we're checking for HCG. So just to recap, in order for a woman to become pregnant, A, she's got to be ovulating, and B, her partner must have sufficient healthy sperm to fertilize the egg. Well, how are we going to improve your chances when you decide to become pregnant? So if you're ready to become pregnant, then the very first thing to do is stop your birth control methods. Stop the condoms, stop taking the pill, stop using the ring, get the IUD taken out. All right, when you stop birth control methods, fertility returns immediately, and that means you don't have to wait for your body to be ready. You do not have to wait 3 months after stopping your birth control. Your body will reset itself within 24 hours, okay? So if you stop using these birth control methods, you can get pregnant right away, so don't stop unless you want to be pregnant. The only birth control method for which this is not true is the Depo-Provera injections. Those need sometimes 6 to 18 months to clear your system. Well, how long will it take for you to get pregnant? Because most couples I talk to, they want to know once they start trying when they might be able to get pregnant. So you can see in this chart, if the woman is under the age of 35, if a couple's been trying for 3 months, about half, about 50 to 60% will be pregnant in 3 months. I mean, that's pretty good odds, right? If they are if the woman is less than 35 and they continue trying for 6 months, about 80% will be pregnant. If they continue to try for 12 months, another 5% or 85% will become pregnant. And if they just keep trying and trying for 3 years, about 91% will eventually become pregnant. After age 35, fertility rates do decrease a little tiny bit, but don't get discouraged because many couples get pregnant after 35, but it just may take a little bit longer than 3 or 6 months. So let me ask you something. Have any of you chosen an OB/GYN provider yet? So Sharon's going to launch this poll. So, have you chosen an OB/GYN? That's an obstetrics and gynecologic provider yet? And you notice we use the word provider because many people choose to see a nurse practitioner like myself, or a midwife, or OB/GYN physician or doctor. All right, so have you chosen one yet? Yes, no, or you're kind of unsure?
So let me share the results. We have it split almost. It's no is 41%, 35% is yes, and 24% is unsure.
Well, if you haven't chosen one, you can go to the El Camino Hospital website, and there's a Find a Doctor link there, and you can choose different criteria like whether or not this person speaks your language. So the Find the Doctor link you can get to on the El Camino website. So, all right, when should you see a specialist? And I know most of you haven't started trying yet, but if you're under the age of 35 and you've been trying for greater than a year, it's time to see a specialist. If you're 38 and you've been trying for 6 months, go see the specialist. And at 40, we don't want you trying any longer than 3 months before you see a specialist. But before you start to see a specialist, let's talk about how to increase your chances of getting pregnant. And I'm so excited because I saw a patient in February, and she said she wanted to get pregnant, and she wanted to know what she should do. And my advice to her is the same advice I'm going to give you today. And guess what? Today she came in for her confirmation of pregnancy. So I did her ultrasound today, and she has a nice 8-week pregnancy with a nice little heartbeat. And I had my little talk with her in February, and it's only April, so they got pregnant pretty quick. And the chances are is that you will too once you start trying. So trying to get pregnant can be a lot of fun, and as some of you may know, it can also be stressful if you've talked to family members or friends, and it can be super stressful if you have a lot of parents or relatives giving you a hard time and saying, when are you going to get pregnant? When are you going to get pregnant? What I'm going to advise you is what most experts also advise, and that is just try to have a lot of fun and a lot of sex. In fact, if you can have sex 2 to 3 times a week, every single week, that means you're more likely to have plenty of sperm ready and waiting in those fallopian tubes when the egg is released and there's ovulation. Remember, sperm can live for 5 days, so having frequent intercourse will increase your likelihood of getting pregnant, even if you don't have sex on the exact day and the exact minute that you ovulate. So please, please try to resist the impulse to run out and buy an ovulation predictor kit to try to figure out the one optimal time to have sex. And that's because it takes all the fun out of trying to get pregnant. Now, at first, you guys might be thinking, Barb, you don't know us. You know, it's really fun. If my partner calls me and says, we need to have sex right now, I'm ovulating, I'm going to run home and have sex. But after a few months of sex on demand, most couples start to feel a lot of stress in their relationship. And this can add a lot of challenges for you connecting both emotionally and physically. So do try to just have sex 2 to 3 times a week, every single week, and you're likely to have plenty of sperm and you're likely to get pregnant. Well, what if your situation is more complicated and you don't live in the same city, or maybe intercourse is not an option for you? There are many couples that I see where the partners live in different parts of the country or even in the world. I have patients who've been married for several years, and yet one of them is pursuing an advanced degree in one part of the world and the other is working here in Silicon Valley. Sometimes people have a lot of pain when they have sex, or sex is very problematic or uncomfortable. Sometimes couples can only see each other for brief mini honeymoons every 2 to 3 months. And this can be a big challenge if a woman's menstrual cycle and her ovulation doesn't line up with travel plans that you might have had to arrange a long time ago because of good airfares. So in these cases, or if you've been trying a while, it's helpful to chart your menstrual cycle by noting the day that your period starts, how long they last, and coming in to see a healthcare provider for a preconception appointment. Healthcare providers like myself can help you figure out when you might be ovulating and how to better time intercourse, any inseminations you might need, or fertility treatments during the 3 to 5 days of the month when you're most fertile. Well, what if you want to predict ovulation? And remember, you can come back to this webinar again and again, and you can use the link that is in the handout section to download this chart that I created with El Camino Hospital. So this is an ovulation prediction chart, and it helps you figure out when you're most likely to ovulate and be fertile. This is also called a basal body temperature chart. So for this, a woman will need a digital thermometer. And in this next slide, you can see that this person is taking their temperature. And you need to take your temperature the very first thing in the morning before you get out of bed, because your basal body temperature is most accurate before you get out of bed, before you drink anything, before you go to the bathroom. So I'm going to say this a couple times. You want to keep the thermometer by the bedside where you can reach it, and you have to get into the habit, and it can take a few weeks to get into the habit of taking your temperature before you get out of bed. You can't eat or drink anything, and you're going to mark your temperature on the chart. Now, in addition to checking your temperature, you can also predict when you're going to ovulate by noticing the changes in your cervical mucus. Now, many women in the audience, I know you guys have noticed that the discharge from your vagina that is on your underwear or on tissue after you wipe yourself can look different at different times in the cycle. Sometimes the discharge is white, and that typically occurs before ovulation. And then it can be a little yellowish after ovulation, but during ovulation and for a few days before, the cervical mucus will resemble an uncooked egg white. It'll be really stringy if you try to stretch it between your fingers. Now, if you don't notice anything on your underwear, don't worry, don't panic. And if, and this is a big if you're comfortable, you can insert a finger into your vagina to check your mucus. Because around ovulation, there's a lot of clear, stringy mucus. So when you insert your finger and you look at what comes out with your finger, you might be able to tell when you're fertile. Now, that stringy, clear mucus has a lot of glucose in it, and that helps nourish the sperm on their journey to the fallopian tubes. So be sure to mark on the basal body temperature chart what your mucus looks like, because that will also help. Now, if you're using a lot of lubricant to have sex, to make sex more comfortable, sometimes it's a little bit difficult to figure out what's ovulation mucus and what's lubricant. But don't worry, because you have your temperature, and I'm going to talk to you about using an ovulation prediction kit. So let's get back to the chart, and let's see how you use this chart to predict ovulation. So as you can see here, on the left side, after a woman's period, her temperature is relatively low. And then it dips down, and then you can see that after the dip, after the green shading, the temperatures are all above what they were at the beginning part of the cycle. So pre-ovulation, the temperature is relatively low, and then after ovulation, it's higher. And that place in between, well, that's when ovulation occurs. See, it's really not that difficult. You don't have to work at NASA or be a rocket scientist to figure this out. But if you can take your temperature every day for a month or two, you'll start to notice a pattern of when you ovulate. So the days circled in blue here, That's when the temperature goes from low to high, and that's when this woman was ovulating. You can also put your mucus down here, and that way you can correlate with your cycle. All right, well, what if you don't want to do this? I mean, this is a lot of work, right? If you don't want to do this, and maybe you want to do an ovulation prediction kit. These are also called an OPK, and you've probably seen these in the drugstore. Ovulation prediction kits, what they do is they're looking for a hormone known as the luteinizing hormone, or LH. Because LH will spike, that means that the value of the level in the urine will get really, really high about 24 to 36 hours before ovulation. So we need the LH level to spike or get really, really high to tell the that follicle to go through its final maturation, and that will signal then the ovary to release the egg. Now, it's best to test your urine between 10 a.m. and 8 p.m. So do not test this first thing in the morning, okay? Now, there's lots of different brands out there, and some of them you're going to sit on the toilet, put this down so that when you urinate, it will touch it. And some of them, they give you a little cup, and then you dip it in there. Whatever you use, it's fine. There's also digital ovulation prediction kits. Some of them have a smiley face. It doesn't really matter. Whatever works best for you. Now, if a woman has her monthly period, if they're 28 days or 30 days, then start testing your urine on day 11. Now, if your cycles are irregular, then you're probably wondering, well, when should I test? Well, I'm going to tell you right now, because it's a little bit more complicated. So if you have to go back and listen to this again, that's okay. But for irregular or long cycles, this is what you're going to do. First, you have to determine how long your cycles are. All right, that means you have to mark down on the calendar when your period starts and when the next period starts the following time. So once you know how long a typical cycle is, then you can make an educated guess about when your next period will start. So in this person's example, this person has a 38-day cycle from the beginning of a period to the beginning of the next. And that's how we chart periods. It's from the start of one period to the start of the next. So if you think, okay, I'm going to have a 38, maybe 40-day cycle, then what I'm going to do is predict when my next period is going to come, and I'm going to count backwards 17 days before I expect my next period to come. So remember, you're going to try to figure out how many days between your cycles, and you're going to start testing the ovulation prediction kit or the LH prediction kit 17 days before you expect your next period to start, okay? Now, this is not when you're ovulating. Remember, this is just when you start looking for that LH spike. Because you don't know, you might ovulate 17 days prior, or you might ovulate 21 days prior. I'm sorry, 14 days prior or 12 days prior. Now let's talk about combining all three. You can combine all three methods to check ovulation. You can check your cervical mucus, you can use your temperature, and you can also use the ovulation prediction kit. So that you can time intercourse, or if you're seeing a fertility specialist, when to have an insemination. Well, we've talked a lot about a woman's body. Let's talk now about a man's body. I know all of you know this, but making a baby, it takes two to tango. It requires sperm from a man. But what you might be surprised to learn is that when a couple is going through infertility, about 1/3 of the cases are due to a male factor. And I've had this question come up many, many times. Many times, a male partner will ask me or the physicians in my office if it's the woman's fault that they're not pregnant in 2 or 3 months. And my answer is always the same. We don't know what is causing a couple not to be able to get pregnant when they want to. And many times it is a male factor. And so sometimes we have to ask a man to be tested and to see a specialist. Now remember, sperm are produced in the testicles, and the testicles are located in the scrotum, and that's under the base of the penis. This location protects sperm from the slightly higher temperatures that are within a man's body. So that's why the scrotum hangs down a little bit lower, keeps everything a little bit cooler, and that ensures normal sperm development. Now, sperm are produced all the time, and they require about 2.5 months to mature. Sperm are ejaculated through the penis within a fluid known as semen. So for the men in our audience, let me ask you something. When was the last time you had a checkup? Have you had a checkup within the last year? Maybe sometime in the last 1 to 3 years? Well, maybe sometime in the last 5 years, or you can't remember. So Sharon, what are we finding from the men in our audience? When was the last time they had a checkup?
It's another roulette wheel. It keeps changing, so I can't tell you what it is yet. Let's give it another few seconds and see what we can come up with. But right now the winner is 60% within the last year, 20% sometime in the last 1 to 3 years, 9% within the last 5 years, and 9% can't remember.
Okay, well that's pretty good. This is a pretty healthy group. I'm very proud of the men in this audience, and those of you who haven't seen someone in a while, now's the time to show your partner your commitment to getting pregnant by getting a checkup. Well, let's talk about male fertility concerns. So what affects sperm? One is temperature. One is undescended testes, sometimes illness or injury, hormonal imbalances, and environmental exposures. So many of you may have heard of something called a varicocele. Varicocele means that there are varicose veins that are present in the scrotum, and that increases the temperature, which can harm sperm counts. This may require surgery to correct. Undescended testes. Sometimes a man will find that the testicles did not descend into the scrotum by the age of 1, and if that is the case, then the sperm count and the number of normal sperm can be affected. Sometimes a man may have had an injury to his genitals. He may have had an illness such as the mumps, or he may have hormonal imbalances like not enough testosterone. Well, let's talk about some of the tests that men may need. The first test that we typically order is a semen analysis. This is the most common procedure. The man will collect his semen into a specimen cup, and it's then evaluated under a microscope by a specially trained lab technician who looks at the count of the sperm, how many millions are present, the shape, the appearance, and the motility. That means the ability to swim forward. Some of the other tests that we often do is we look at the morphology that relates to the shape and the appearance. Only normal healthy sperm with a normal shaped body and tail will be able to fertilize an egg. We'd like to see about 15 million sperm in just a milliliter. Now, think about a teaspoon. A teaspoon has 5 milliliters. That would be 75 million sperm in a teaspoon of fluid. That's 75 million chances to get pregnant. But remember, you need a lot of sperm waiting for that egg when it ovulates. Now, for a man who has less than 15 million sperm per milliliter, he may need to see a urologist or fertility specialist. Sometimes if there's an infection, men will need to be treated with antibiotics, but in any case, there are specialists like urologists or reproductive specialists that can help. So how do you improve the chances of fathering a child? Well, remember, you don't want to have excessive heat. That means stay out of hot tubs and stay out of saunas. Now, on the left, what that is that's a pair of jeans drying. And so really, really tight jeans can pull the testicles up way, way too high, close to the body, and increase the temperature and harm the sperm. Also, cyclists who spend a lot of time with very tight bike shorts that may be a little too warm for the sperm. So when we talk about male partner concerns, there's also sometimes some sexual concerns, and we so often, I think there's this idea that people expect that men can have sex anytime and in any situation, but you know what? That's just not true. It's very common for men to say that the pressure to have sex on demand makes it very difficult to have an erection or to keep an erection. And it's also very difficult to have an ejaculation. When it comes to evaluations by healthcare providers, men can feel particularly vulnerable, and it is very, very intimidating to talk about a concern that's so personal and so private. It's very normal if you're feeling like you would never want to give a semen sample. One of my patients' husbands told me he'd rather see the dentist and have a tooth pulled than to have anything done that pertains to his genitals. So you're not alone if you're feeling like this is something you'd rather avoid. But I don't want you to let fear or embarrassment prevent you from getting the care you need if this becomes an issue in your relationship. So we have a wonderful Find a Doctor portal here at El Camino Hospital. And it's kind of cool because the men's health program at El Camino began with a focus on urology. And our efforts here are led by fellowship-trained, board-certified urologists. And we have a highly rated hospital-based urology specialty here. We're one of the very first comprehensive men's health programs in California, and we've expanded it to encompass a much wider range of care, and it's delivered by a diverse team of doctors who are very skilled at observation, diagnosis, and the latest therapies and treatments. I've sent many patients to and many couples to the local urologists who've been able to get the treatments they need to become pregnant. So we've talked a lot about male partner concerns and a woman's menstrual cycle, how to increase your chances of getting pregnant. But what does El Camino Hospital have to offer you as a couple as you plan to become pregnant? So tonight we're doing a webinar, and we have 2 more coming. I'll tell you about those in a minute. You can use the Find the Doctor portal to find an OB provider or a urologist, and you can search based on whether someone speaks your language or has certain credentials that you'd like to see. We also support and welcome midwives and doulas here at El Camino. There's a lot of other community resources. I think El Camino has a lot to offer. This is where I delivered my son many years ago, and I hope you'll consider El Camino for your family as well. So we have a health library resource center should you need it. We also have many culturally appropriate programs and services related to specific health concerns, such as diabetes and heart disease in people who are of Indian ancestry and those folks who are from South Asia. There's quite a bit of hepatitis in people who come from China and other parts of Asia, and we are fortunate here to have many specialists who can help with that. We have a South Asian Heart Center and a Chinese Health Initiative. We also have on-site translation services for family and patients. We've done a lot to make sure that the food service has a variety of yummy foods from all over the world, so you don't have to bring your own. You can if you want. We have support classes that are offered throughout pregnancy, including childbirth preparation, new parenting classes, breastfeeding classes, even drop-in breastfeeding support groups. And you know what else is cool is that for every single mom who delivers here, they are visited by a lactation consultant. And we have a lactation center for drop-in help or help with by appointment. Now, the delivery rooms are private, and they have very nice, comfortable fold-out beds for partners and families. Gosh, we have covered a lot today. We talked about nutrition, how to understand your menstrual cycle, how to do an ovulation prediction chart. We talked about male partner concerns, and gosh, so much more. So I hope you guys have found this helpful. And before we get to questions, I want to tell you about our next webinar. Our next webinar is coming up in 2 weeks. It will be held on Tuesday, May 7th at 7 p.m. And this is going to be a very hot and sexy top webinar because we're going to talk about sex, how to have sex if you're having issues, any sexual concerns you might have, a lot about tests and other concerns as you work on getting pregnant. So we're also going to discuss what to avoid when you do become pregnant. You're going to get an email after this webinar with an invitation so you can sign up for the next one, as well as a link for the resources. And there's going to be an evaluation survey, and this is super important because that's how we plan for future webinars. So I hope when you're ready, if you want to view this webinar again, please wait a week to go to nursebarb.com. I'll have it on my website, and El Camino will have it in their YouTube library. So I want to thank you again for your patience and for staying here. So can you
Does masturbation affect sperm count for men?
Masturbation does not affect sperm count for men. So many men and many women masturbate regularly. Masturbation is a great way to have a sexual release. It's also a great way to fall asleep at night. When a man masturbates and he ejaculates, anytime a man ejaculates, like we say, like if there's ejaculation more than once every 24 hours, the sperm count goes down, but the ability of the sperm to fertilize the egg improves. So I would say if you're concerned that you might be masturbating, 5, 6, 7, 8 times a day and it's hard to go to work, that might be something to talk about with your healthcare provider. But no, masturbation is not detrimental.
So when do you suggest taking a pregnancy test if the female is late?
So if the woman is even 1 or 2 days late for her period, absolutely do the pregnancy test. And the pregnancy test, you want to do that first thing in the morning.
What should I put in the search bar in the website if I want to do a prenatal and then it stops? So I'm afraid I didn't get that entire question, so if you'd like to include it again, that would be great. Here it is, prenatal appointment.
So if you want to get a preconception appointment, you can make an appointment with any OBGYN. Everybody does it. If you're concerned, I'd give them a call and said, like to come in for a preconception appointment. Sometimes people come in just to interview us and see if there's a fit, and see how we you know, meet your needs.
So what if my husband has no sperm?
Well, if your husband has no sperm, then there are some medications that can be given to increase the sperm. Sometimes men have one or two or a few sperm. Reproductive endocrinologists can sometimes take that sperm and do something called ICSI, that's intracytoplasmic spermatic injection. That's a mouthful, isn't it? That means that a reproductive specialist might be able to take someone with very, very low sperm count and still use the husband's genetic material and the wife, the male partner and the female partner, and use their same genetic material. But there are many, many couples for which the man has no sperm, none, zero. And in that case, many couples choose to use donor sperm. And there are many cryobanks where couples can choose someone who resembles their partner in lots of ways, not only physically, but maybe intellectually or in terms of hobbies or ethnic background. How many eggs do women have? Well, women, when they are in their own mother's uteruses, when they're growing in their mommy's tummies, they have several million eggs. And every single month, some eggs are what we call recruited, and then they die. So as women get older, when they go through puberty, they don't have as many left. And so there's this constant process of follicles or eggs being recruited and dying off. So every month, most women will produce about 6 follicles on both sides of the ovary. So about 12 eggs get used up while one gets ovulated. So as women get older, as they approach menopause, as they get to be 40, 41, 42, they have fewer and fewer eggs, and the eggs they do have are much more likely to not be what we call viable, not able to be fertilized. Why is it important to have a prenatal vitamin with folic acid? The reason that you want to start that prenatal vitamin at least 3 months ahead of time is that it's been shown to reduce the risk of having a baby with a spinal cord or neural tube defect. Now, these defects are pretty rare. They only occur in about 1 in 1,000 children, but we want to reduce that even further by making sure you have a prenatal vitamin with folic acid.
We've kind of reached the top of the hour, so we're going to have to close out the webinar. This has been great, full of terrific information. So I want to thank everyone for coming, and have a great rest of your evening. We hope to see you next month.
Thank you so much, and please sign up for our next webinar. Thanks, Sharon.
Okay, thanks, Barb. Bye-bye.
Bye-bye.